This presentation is part of a new virtual education series developed by the National Mass Violence Victimization Resource Center, or NMVVRC, called the MVI SNAP series. The goal of the SNAP series is to provide a brief 20 to 30-minute skills-focused presentations on an array of topics relevant to mass violence readiness, response, recovery, and resilience. Each SNAP will focus on 2 to 3 specific objectives or takeaways. Today's SNAP webinar focuses on an overview of the National Mass Violence Victimization Resource Center. Here are the learning objectives for today's presentation. First, we'll provide background for development of the National Mass Violence Victimization Resource Center. We'll then identify and access the resources offered by the NMVVRC, describe our partners, and identify technology and other resources available following mass violence incidents. The National Mass Violence Victimization Resource Center was established on October 1, 2017, as a cooperative agreement with the Office for Victims of Crime to address myriad concerns and consequences surrounding mass violence incidents that were rapidly occurring throughout the United States. Our mission is to improve community preparedness and the nation's capacity to serve victims and communities recovering from mass violence through research, planning, training, technology, and collaboration. The NMVVRC has developed a very comprehensive website that includes resources for civic leaders, mental health professionals, journalists, policymakers, first responders, and victim service professionals. Our vision is to provide communities access to evidence-based information and resources needed to effectively prepare for and respond to mass violence incidents. This website is updated frequently and contains a wealth of resources. The NMVVRC has developed over 50 tip sheets for a range of professionals and communities focused on various topics, including typical responses and symptoms after a mass violence incident, preparing for mass violence incidents, how to identify an experienced trauma-focused therapist, the role of victim service professionals in responding to mass violence incidents, and a guide to evidence-based treatments and practices. These tip sheets can be shared freely and are often distributed in response to mass violence incidents, as well as through the recovery process. Please visit the NMVVRC website for access to all of these tip sheets. In addition to tip sheets, the NMVVRC team and their partners have developed several more comprehensive publications that provide more in-depth information about important topics noted by our stakeholders in the field. Some important publications include the MVI After Action Report Review, which includes a review of after action reports published to date, recommendations for how to improve after action reports, as well as a template for these reports. One of our partners, the Police Executive Research Forum, developed a publication that outlines lessons learned from the field in response to various mass violence incidents over the past decade. Another very useful publication, the Planning and Implementation Guide for Comprehensive Coordinated Victim Assistance for Mass Violence Incident Trials, was designed to help prosecutors, victim services, mental health providers, and allied professionals plan for high-profile trials, with a focus on victim and survivor needs and effective and coordinated strategies to meet them. The guide was created by the NMVVRC and the U.S. Attorney's Office from the District of South Carolina, with support of the U.S. Department of Justice Office for Victims of Crime. It is important to keep in mind that individuals learn and process information in many ways, including an array of training methods, styles, and approaches increases our ability to reach a wide range of victims, survivors, and trauma professionals, and enables us to deliver information that reflects the diversity of our audience. We recognize that trauma experiences and trauma-related symptoms may interfere with memory, learning, and the ability to absorb new information, which can lead to avoidance of certain topics. Thus, awareness and sensitivity are critical to maximize uptake of information and to create a positive learning experience. Another fabulous resource developed by the NMVVRC team is the Core Compendium, which includes 26 modules that feature written and audiovisual resources, as well as intensive training strategies to increase knowledge and build professional and practical skills. The compendium can be tailored to be delivered in person, through virtual platforms, or by a hybrid training delivery process. The aim of the compendium is to share our compilation of existing resources, offer an array of training opportunities that complement existing content with a specialty focus on behavioral and mental health, and provide information about other training resources as warranted. The NMVVRC holds quarterly town hall virtual meetings, which are an excellent opportunity to hear from subject matter experts in the field about important and timely information related to preparedness and response to mass violence incidents. These town hall meetings are 90 minutes in length and consist of a presentation and time for questions and discussions as relevant. Please check out our website and social media to learn about the next town hall meeting. The most widespread and useful resource for victims following a mass violence incident is the Transcend NMVC app. This free app was developed to assist with recovery from the psychological and behavioral response that can occur following direct and indirect exposure to mass violence incidents. This app is free, and it can be downloaded from the Apple App Store and Google Play. The app provides information about common reactions to mass violence, crime, and other stressful events, guides you through state-of-the-art self-help strategies to reduce the risk of stress-related behavioral health problems and promote recovery if you already have problems, and connects you with access to victim and survivor services, financial, legal, and mental health resources. The app was designed for those directly affected by mass violence and their families and friends, but it may also be useful for victim service providers, law enforcement officials, other first responders, and healthcare professionals who respond to mass violence, mass casualty incidents, or other violent crimes. Others in communities that have experienced mass violence could use this too, as well as violent crime victims and their family and friends, and essentially anyone who had an extremely stressful experience with which they're having trouble coping. The NMVVRC has partnered with many experts in the field to develop podcasts specifically related to topics that are of interest to victims, providers, and communities. Over 20 podcasts have been developed that cover a range of topics. Check out our website to view these podcasts and to share them widely. Most of the resources and products described have been materials that can be used anytime and for anyone to help with preparedness, response, or resilience related to mass violence incidents. But what do we do for communities in the immediate aftermath of a mass violence incident? Our team follows all news outlets and social media to immediately determine when a mass violence incident occurs across the country, and we're often alerted directly from OVC or one of our partners. Whenever an event occurs, the NMVVRC team quickly compiles a list of resources that are directly related to the details of the mass violence incident and mental health surrounding it. For example, if the MVI involved a school shooting, we'll include resources specific to children and families, and if it involves hate-based violence, we ensure that resources are included to address hate-related crime and the particular impact. These resources are posted on social media and distributed directly to our stakeholders and partners, including the U.S. Conference of Mayors, National Governors Association, American Hospital Association, and other partners as relevant to the event. These partners are tasked with placing these resources in the hands of appropriate individuals in the affected community. We also reach out to news outlets in the impacted area to provide this list of resources for distribution, and we make ourselves available for interviews or information gathering as needed. The NMVVRC collaborates and works with various partners across the United States that work with players involved in mass violence incidents. Our principal partners include the American Hospital Association, National Governors Association, and the U.S. Conference of Mayors. We meet monthly with these partners and work together very closely to develop materials, disseminate resources, and provide the best possible assistance to victims and communities impacted by mass violence. Social media and online resources are the most commonly searched places for information and are immediately accessible. The NMVVRC has developed and constantly updates a range of sites to disseminate information, including immediate resources following an MVI, anniversaries and remembrances, and all of the resources discussed earlier. Please follow our social media and online sites to stay connected and to receive the most up-to-date and relevant information related to our center and mass violence incidents. Thank you so much for listening to our overview of the NMVVRC and all of the resources that we develop and disseminate to assist victims and communities in the preparedness, response, and resiliency phases of mass violence incidents. Please visit our website and social media sites for access to all of this information. If you have any questions or would like to request additional resources or information, please don't hesitate to contact us at the NMVVRC. Thank you for participating in this NVI Snaps webinar.